Dr. Sean Malone. I'm a radiation oncologist at the Ottawa Hospital. I have a special interest in prostate cancer research.
I've been involved with Motorcycle Ride for Dad now in a partnership for about 5 years now, and it's been quite an exciting development in our laboratory.
Jim is looking at novel therapeutics, looking at prostate cancer cell lines, and trying to, again, get better treatment strategies for those who've failed all the conventional treatments.
Tissue culture is just basically growing the prostate cancer cells. We had this combination therapy where we added a cholesterol-lowering drug to a well-established anti-cancer drug. And we showed that the combination was very active in a number of tumor types. So we're looking at protein levels.
Eventually what will happen is we find new drug treatments which are beneficial. Those will be moved earlier in the stage of disease, again for those high-risk patients that we hopefully will identify through biomarkers.
The Motorcycle Ride for Dad money allowed us to include prostate cancer patients in our trial. So we leveraged that quite dramatically to have new therapies for prostate cancer patients at our institute.
My laboratory first started getting funding from the Ride for Dad program probably around 2003. So it's been at least 10 years now that we've been supported by that organization.
Like they might be too GC rich.
Dr. Addison has a particular interest in our most aggressive forms of prostate cancer, the patients who have spread of the cancer to the bone, looking at mechanisms for why these cancers spread to the bone.
Protein levels, and then
We've been looking at a family of surface molecules called integrins.
Again, the monies from the Ride for Dad have helped with our research there and is going to definitely make further improvements in survival for future patients.
And we actually found that if we got rid of those proteins on the surface of prostate cancer cells, they couldn't spread anymore, they couldn't metastasize. The idea in the long term would be to actually use these agents, once patients have been treated for their initial disease by surgery or radiotherapy, to use these agents thereafter to try to prevent the spread of the tumors to the bone so that we can block recurrence or metastases in the first case.
What this kind of research is going to lead to is actually novel therapeutics. That's really what's going to make future gains for patients quickly, and that's critical.
I personally have never actually done the rides, in part because, one, I don't know how to ride a bike.
Unfortunately, my wife won't let me ride a motorcycle.
I've gone to watch, but I don't ride a motorbike. So.
I guess just in the context of what the donors for the Motorcycle Ride for Dad do for us, I don't think they have a concept of how important their actions are and how important their contributions are. They're, the people who volunteer, the people who raise money, the people who participate in the ride, and even the people who get the information out there. They help us disseminate the research findings that we have, and it helped disseminate how important it is to get early detection for prostate cancer. And I just, really from the bottom of my heart, thank them for everything that they do.